Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. My name is 𝗠𝗷𝗹𝗶𝘀 and I'm family medicine consultant. And today is a great pleasure to talk about a condition close to my heart as a family doctor. And who's best to do that than Dr. Rabah, my next door clinic neighbor. Dr. Rabah.
Thank you so much for hosting me in this broadcast. My name is Dr. Rabah Elbahnasawy. I'm a specialist in internal medicine. I have a lot of experience in the Middle East, so I can provide the greatest help to the patient effectively.
And I have no doubt, and you do that, and I've been working with you for a while. Today we're going to talk about a core topic affecting our day-to-day activities, and the topic of chronic conditions, chronic medical conditions. So very briefly, what are and how do you define chronic conditions, and what are the most common conditions you see in your practice, Dr.
Thank you so
Rabah?
much for this question. It is very important for us really to differentiate between chronic conditions and acute condition. Chronic condition is a disease that there is no cure, like increasing blood pressure, increasing blood sugar, uric acid, bronchial asthma. The aim of the treatment for these diseases is not to cure, because we said there is no cure. The aim to control the symptoms, to prevent complication, and to maintain regular intake for this medication to avoid complication in the future. Okay. This is in contrary to the acute medicine, which is like flu or diarrhea. You take a medicine a few days and then you get better, you stop the medicine. So the chronic condition is a lot. Some of them, they are increasing blood pressure, coronary heart disease, diabetes mellitus, obesity also is a chronic disease, and inflammatory bowel disease of the colon, and a lot of chronic conditions.
Fair enough. So it's a complex group of diseases, basically, and has many issues. So if we start with symptoms, so of course, sometimes, and a lot of patients, so if I'm sick today, my worry is because I have a cough and I have a symptom, and the focus is to treat the symptom.
Yes.
Whereas in this condition, if I get it right, with the chronic conditions, it's more important maybe to address the cause. So how do you address that, or how can we work around that?
It's very important when we are looking to a patient with chronic condition, we don't look to the symptoms only. We look to the what is called root cause. Because, for example, I'll give simple example. If the patient has a fever, and we don't treat the fever only, we look for what is the cause of the fever. We might find pneumonia, another disease. For example, we are seeing this every day. It is diabetes. Why the patient got diabetes? You will find he has obesity. If you treat the root cause, which is obesity, he might be cured from diabetes. So all the time we should look for the root cause disease.
Fair enough, if we can, and that's the challenge, and that's where the skill
this
actually...
This is a big challenge.
Perfect. Now, obviously, because it's a chronic condition, and like you said, it's complicated, it's for life, and it's a bit depressing when someone hears that there's no cure.
Exactly.
How, and what are the challenges, actually, that patients commonly face? And again, this is from your experience. What are the common challenges that you think patients with chronic disease face?
Usually the patient, if we tell him that you have a chronic disease, like, for example, hypertension, first of all, he will be resisting that I don't have hypertension. I got upset. I came angry or something like that. So we have to absorb this and explain it to the patient properly. And the second problem is compliance. Many patients, we ask them, take this medicine, you have chronic condition, and they don't use this medication. Let me give you an example. We have conducted a clinical audit in our hospital about the compliance of patient taking medication for cholesterol. Do you imagine among the number of the patient, how many became compliant? Only 46%. So this we have a lot of issue to speak with the patient. The second thing about after the rejection of the patient, the compliance, the patient should follow up. The aim of the follow-up to prevent and treat complication as early as possible. And again, one of the follow-up, we have discussion with the patient about the condition, about the improvement, about the control, about the side effect. Usually do this every visit with the patient. He come to visit us.
Fair enough. Now, I'm going to be the devil's advocate, so I'm going to be the patient, and I'm going to ask the question as a patient, not as a doctor. I find it one of the most difficult things is that when I don't have a symptom and I'm well, to accept that I'm taking a medication for life and I don't feel any different, then maybe that starts affecting my compliance. And And now I'll put back the hat as a doctor and say like, okay, the silent diseases, right? That's what kind of we talk about. Can you talk to me more about them? Like, why is it important then to get treated? And how do you, if I don't have a symptom, how am I going to present to the doctor? Does it make sense?
Yes, usually the patient come for follow-up. For example, I want to do checkup for something, and we discovered abnormality in the blood test, for example, like the cholesterol. And he reached the limit that he should be treated. And again, the patient will say, I don't have symptoms for that. So then it is all on the doctor to explain the process of the patient, how the disease is progressing, and how it will affect his health in the future if he didn't take treatment and became compliant to this treatment. Many patients, they are afraid from the side effect of the medication. Again, this is on the doctor to explain to them that this is very minimal side effect, 2 to 3%, for example, and he should take it. And the doctor has to make sure that the patient has no other concern and everything is well digested to the patient, and then he will follow your instruction and take the medicine.
Fair enough. And you mentioned that the importance of the follow-up and then the compliance. So I know you mentioned it, but I'm going to ask the question again. So why is regular monitoring important? For patients listening to us today saying, like, listen, I was told 2 years ago I have blood pressure. I was told I'm pre-diabetic, but to be honest, I'm looking now after what I eat. I feel okay. I don't see anyone. Why is it important? How would that affect my health if I don't really follow up regularly with my doctor?
Because usually we start the medicine in steps. For example, the patient presented with very high blood pressure. We don't give him one medicine and that's it. No, we have to follow up the patient. We know how is the patient blood pressure condition is improving, and we have a target. We are not giving the blood pressure, that's it. No, we have a target we should reach. If we didn't follow up the patient, we are not aware of the target. We are not sure that he is taking the medicine or no. So we are following the patient to reach our target. We should reach the target, then the treatment is successful. Same apply for blood sugar, for uric acid, for all of the chronic disease.
And if I may add, and sorry, I think now because you're reminding me, I'm still a doctor, so I have to kind of keep thinking as a doctor, because I usually tell my patients that we're not equal. That if you and I, like yourself and myself, are both starting blood pressure medications, I might end up needing 3 tablets. Yes. But of course, you will not put me on 3 tablets from day one, because my blood pressure will drop, and then I will not be happy.
Yeah,
and that's
this is not medically justified as well.
So it's not a race. It's just basically person kind of tailored treatment plan, and that's very important for chronic conditions.
And this is good word you said, that you are tailoring. I tell them the doctor like a tailoring. He's adjusting a suit for you. You cannot buy the suit from the first time. He has to adjust the shoulder, the waist, and then till it is perfectly fitting you.
And also in a year time, it might not fit anymore. So we need, and that's maybe why monitoring is important. Okay, and that's important again, because it's not all about just the marketing or the commercial aspect. I mean, and that's where we're here. We're here to kind of tell patients that it is your health, and you have to run the show. I mean, we are here to guide you, right?
Yeah.
Fair enough. Sorry, went a bit off topic, but it's just I got excited about the discussion. Now, it's a chronic condition. It's a condition that has no cure. It's for life. But of course, most of these conditions are multisystemic.
Yes.
So I know you're an amazing doctor, internist, and family doctors. I always joke we're the best doctors in the hospital.
Thank you.
But we still have respect for our colleagues. How do you coordinate with the other specialists? Because, like I said, you mentioned diabetes, multisystemic, obesity, multisystemic, hypertension affects everything. Is it a one-man show? How does it work? And what is the definition of what we call MDT sometimes in meetings? No,
definitely it is not a one-man show. It is a teamwork. If we put an example for the patient with increasing blood sugar diabetes, we know that diabetes will affect many organs in the body, will affect the kidney, will affect the heart, will affect the brain. So I'm treating the patient, going through the target. During the follow-up, I might discover something. For example, I will discover some infection in the WIP2. Then I have to refer to dermatology. For example, if I have some changes in the ECG, I have to refer him to cardiologist to have a look. And definitely the eye. The patient diabetic should see the eye doctor once a year. This is routine. So every year he should go to the eye doctor. So it is like a teamwork. We are all working together to prevent complication, keeping the medicine under tight control.
Excellent. And it could trigger what sometimes I call like fatigue, patient fatigue, where they're seeing many specialists. So you're basically kind of running the show, but making sure they're seeing the right specialist if needed.
Yes.
Okay. And how does that work at Emirates Group?
We are very cooperative at the Emirates Group. Usually some other people, they will say you have to go to book appointment and depend on the availability of the doctor. But in Emirates Group, we don't apply this much.
So now we're a bit biased. We both work there and I know we enjoy working there. But what makes our group then special compared when it comes to this MDT approach or the multidisciplinary?
It is a teamwork. I never, for example, in my practice, I need to refer. One patient came to me. I told him, you have to see dermatologist, for example. I will not tell him go book appointment. I call my colleague. I will send one patient. I know he has double booking, triple booking. He will never say no. Same, if the doctor, khalas, my duty is finished, I'm about to go. I told him, no, you have to see this patient before you go. Send the patient straight forward and he will see the patient. This is teamwork. We are all concerned about the patient health.
And that's patient care really
Yes.
at the core, which is most important. Now, I know we can talk more and it's very hard to go into specifics, but if I want to bring this to an end and I say like, okay, what advice do you give patients or people listening to us today with struggling with their current conditions? Any last minute message, any advice to say that this is what you need to do?
A lot of factors you have to stress to the patient. Don't listen to the media, TikTok, Facebook. There is a lot of fake information. Take the information from your doctor.
So I don't get my information from there anymore because that's what I do in my practice.
No.
So I should stop.
Some of the TikTok, they are fake. They are just commercial. They are not concerned about the actual medical point of view. So take your advice from your doctor.
Expert, yeah.
Follow the instruction of your doctor. Have a regular follow-up with your doctor. And if you have a concern, the doctor is the only one who will apply, will respond to your concern, whatever it will cause. And usually we don't give only a talk to the patient. In my practice, I watch a video with the patient regarding the condition. I draw some drawing for them, or I will let them see a photo about their condition. And I think this is very valuable and it will address many of the concern of the patient. Sometimes the patient will tell me, I will not take the medicine. Why? I will just give him a photo and explain the photo for him, and I'll tell him the decision is yours. You will take the medicine or no. They say, yes, we will take. So this is very important. The communication, the patient concern is very important in practice.
Excellent. And that's absolutely correct. And I cannot add more. You've done a great job. Thank you very much, Dr. Rabah.
Thank you so much for hosting me.
This brings our episode to an end today. Thank you for listening, and please stay tuned for a new episode of Al Majlis podcast very soon. Thank you.
Thank you. Thank you.